A doctor murdered 218 of his own patients. Then he won Doctor of the Year. Harold Shipman walked into elderly homes with a black medical bag. Inside was diamorphine. Enough to kill. He injected his patients during routine house calls. They trusted him completely. Within minutes they were dead. He signed their death certificates himself. Old age. Natural causes. Nobody questioned it. For 23 years. But on September 7, 1998, police found something in Kathleen Grundy's body. Something that didn't belong there. Morphine. Lethal levels. Shipman had made one mistake. He forged her will. Her daughter Angela Woodruff was a solicitor. She knew something was wrong. The will was typed on Shipman's typewriter. Police exhumed Grundy's body. The toxicology report came back. She'd been murdered. Detectives started looking at other deaths. What they found was unbelievable. Patient after patient. All Shipmans. All dead under suspicious circumstances. The investigation became the largest in British history. They exhumed 12 more bodies. All had lethal morphine levels. But that was just the beginning. Harold Frederick Shipman graduated medical school in 1970. He seemed normal. Married. 2 children. He got his first GP position in Todmorden, West Yorkshire. Colleagues noticed something odd in 1975. Shipman was prescribing himself pethidine, a powerful painkiller. He was addicted. The practice caught him forging prescriptions. He admitted everything. He was fined £600. He entered rehab. Everyone thought it was over. Just an addiction problem. They were wrong. In 1977 he joined a practice in Hyde, Greater Manchester. He was charming. Patients loved him. He made house calls when other doctors wouldn't. He spent time with elderly patients. He seemed to genuinely care. His patient list grew to 3,000 people. In 1993 he opened his own practice. He was completely independent now. No partners watching over him. No one checking his prescriptions. No one monitoring patient deaths. He had total control. The death rate among his patients was significantly higher than other local practices. But nobody noticed. Or if they did, they didn't ask questions. He was Dr. Shipman. The kind family doctor. Everyone trusted him. In 1998 a local funeral director named Alan Massey noticed something strange. Too many of Shipman's patients were dying. All elderly women. All found sitting fully clothed. All died suddenly. Massey mentioned it to other doctors. They dismissed him. Shipman was too respected. Too trusted. The truth was far worse than anyone imagined. After Kathleen Grundy's exhumation, Detective Inspector Stan Edgerton took charge. He pulled Shipman's patient records. The pattern was impossible to ignore. Between 1995 and 1998 alone, 143 death certificates. All signed by Shipman. All his patients. The national average for a GP that size? Maybe 20 deaths. Edgerton's team interviewed families. The stories were identical. Shipman arrived for a routine visit. He said the patient looked unwell. He gave an injection. Usually said it was a vitamin shot or antibiotics. The patient died within minutes. Shipman told families it was a heart attack or stroke. He comforted them. He signed the death certificate right there. No autopsy needed. No questions asked. One woman named Bianca Pomfret died on December 10, 1997. Shipman visited her at home. She was recovering from a broken hip. Otherwise healthy. He gave her an injection. She collapsed. He called her son. Told him she'd had a heart attack. She was 49 years old. The death certificate said coronary thrombosis. Police exhumed her body. Lethal morphine. Another victim was Winifred Miller, 73. Shipman visited on May 11, 1998. Her friend was there. Shipman asked her to wait outside. She heard him say, "This won't hurt." Minutes later, Meller was dead. Here's what nobody noticed at the time. Shipman was stealing drugs from dying patients. He'd visit terminal cancer patients. They had legal morphine prescriptions for pain. He'd record giving them their doses. But he kept the drugs. He stockpiled diamorphine. Then he used it on healthy patients. The system had no safeguards. GPs could prescribe controlled drugs, sign death certificates, all without oversight. Shipman exploited every gap. On September 7, 1998, police arrested him. They searched his home. They found the typewriter used to forge Grundy's will. They found medical records. He'd altered them, changed symptoms, made healthy patients look sick, backdated entries, created false medical histories. But what came next was even more disturbing. Shipman's trial began on October 5, 1999 at Preston Crown Court. Prosecutors charged him with 15 murders. All women, ages 49 to 81. The evidence was overwhelming. Toxicology showed lethal diamorphine in every exhumed body. His medical records had been falsified. The typewriter matched. His prescribing records showed massive unexplained morphine use. But here's the truly horrifying part. The trial only covered 15 cases. After his conviction, Dame Janet Smith led a public inquiry. It lasted from 2001 to 2005. She investigated every death under Shipman's care. The final report was 2,500 pages. Her conclusion? Shipman killed at least 218 patients. Possibly 250. Over 23 years. That makes him the most prolific serial killer in modern history. More than Ted Bundy. More than John Wayne Gacy. And he did it as a trusted doctor. The inquiry found his first murder was likely in 1975. Eva Lyons, 70 years old, died during a home visit. Shipman was still in Todmorden. Still early in his career. He'd been killing from the beginning. The pattern was clear. He preferred elderly women. Living alone. He'd arrive unannounced. Claim he needed to take blood. Give the lethal injection. Sit with them as they died. Then falsify records. The inquiry found 177 of his victims were women. 41 were men. Most were over 75. He killed in their homes. In his office. In nursing homes. The psychological profile revealed something chilling. Shipman felt powerful. He controlled life and death. He played God. Former patients testified he seemed to enjoy the trust. The authority. Some researchers believe he got a thrill from the deception. From comforting families. From being the last person his victims saw. And here's what makes it worse. Multiple people raised concerns over the years. The funeral director in 1998. A taxi driver who noticed too many deaths. Other doctors who saw odd patterns. Every single warning was ignored. The General Medical Council did nothing. The NHS did nothing. Local coroners asked no questions. If anyone had investigated in 1985, 180 people might still be alive. On January 31, 2000, Shipman was convicted of 15 murders. He was sentenced to 15 consecutive life terms. The judge recommended he never be released. Shipman showed no remorse. No emotion. Harold Shipman hanged himself in Wakefield Prison on January 13, 2004. He was 57 years old. He never confessed. Never explained why. The family's got no closure. After Shipman, Britain changed its entire medical system. The Shipman inquiry led to 200 recommendations. GPs can no longer sign cremation certificates alone. 2 doctors must review every death. Controlled drug prescriptions are monitored electronically. Random audits check patient death rates. The General Medical Council was reformed completely. But here's the terrifying question. How many Harold Shipmans are still out there? In 2000, Dr. Michael Swango in the United States killed at least 60 patients. In Germany, Niels Hobel murdered 85 patients between 2000 and 2005. The medical profession attracts people who want to help. But it also gives power, access, trust, and systems still aren't perfect. Even today. If a story like this kept you here, subscribe because we uncover a new dark truth every week. And here's something nobody talks about. Shipman's wife Primrose still claims he was innocent. She visits his grave every week. What did she really know? Subscribe and hit the bell for a new dark truth every day.